Hi, my name is Ganesh, and we'll be going over how to apply to 4 different programs that provides low-cost health insurance coverage. So the first program is called CHIP, which is the Children's Health Insurance Policy, which provides low-cost healthcare to families with children and low income. The second program is called Medicare, and it provides health insurance to older individuals and people with disabilities. Our third program is Medicaid. It's a health insurance program that provides care to low-income individuals. And then our fourth program is called the Affordable Care Act, also abbreviated ACA, which is a reform law that increases health insurance coverage. We'll be using the abbreviations CHIP and ACA throughout the presentation, so feel free to always refer back to this part of the presentation if you need a reminder of what they stand for.
Hi everyone, my name is Victoria Hong. I'm a junior studying MEB at UC Berkeley, and I will be going over how to apply to CHIP, which is the Children's Health Insurance Program. It's essentially a health insurance program that's offered to families with children who don't qualify for Medicaid, and this is just a more affordable, low-cost option for health insurance for children. Okay, let's see. So CHIP, you want to first check out if you're eligible. And so we provided a link here. Everyone who has access to the slides should be able to access the link. But if not, this is just like an eligibility website, which can be found pretty easily through Google. If this is not able to be found, you can also go to Cover California, and Cover California will also direct you to an eligibility link. But this step isn't necessary. It's just more so of a way to make sure that you're not putting in more time and making sure that you're using your time effectively so that you know if you're actually qualified or not before you start the whole application process. But yeah, so you'll put in your zip code, and then after putting your zip code, it asks if you confirm the county, which we live in Alameda, so that's why it says that. And then you fill out general information of like either yourself or the minor you're applying for. And this is just like household information, as well as like contact information that should be there, and any other insurances that you might be interested in. But in terms of like Covered California itself, they also provide you to a page. And so this, which is the link provided right here under application. But if you want to search up ca.gov, it will also take you here into finding out if you're eligible for CHIP or not. Then going into the actual application process, which is a little bit longer than just checking for eligibility. The link is right here, but you can also search up the like CHIP application on Google, and it should be one of the first things that pop up. But CHIP just has a paper format. If the website, like through Cover California, isn't accessible, then there is a paper form and general information that you want to fill out. It's going to be asking for information such as social security number, and which is all noted at the beginning. It tells you like what information is required, but everything is private and secure, and so that shouldn't be like a worry. And then this area right here kind of goes over the other application processes. So if you want to apply online, then Cover California would be this safest and like secure and fast option to apply. But if you do want to fill out the paper application, the address is right here. It's like Cover California, PO Box, the number, West Sacramento. And then if there's any additional questions in regards to filling out the application, if Cover California doesn't answer your questions, then there is a customer service number, which is listed. I don't know if I can highlight it, but it should be listed right here. Yeah. And there's also like in-person agents, but I think that would all be listed under the Cover California website or number. And so, yeah, that is how you apply to CHIP. I know this was really fast, but it's a relatively simple process. The biggest thing is just like a waiting game in terms of like hearing back from our agents or anything like that. Thank you.
My name is Armida. I'm a third-year student studying nutritional science and psychology at UC Berkeley. And today I want to talk about Medicare. Medicare is usually for people who are above 65 years old or younger with certain disabilities. And we're going to look into eligibilities and all that for Medicare. But I want to mention that there are links to more information on each slide. So I would make sure to look into those when you are considering Medicare. So there are different availabilities and different eligibilities for Medicare. There are some of them are included here, but these are not the limits. I would again check out the link on it, but there is availabilities for get disability benefits, people who are working past 65 years old, have end-stage renal disease, have coverage from the marketplace, have ALS, need a special enrollment period or have to pay for Part A. And the special enrollment period and Part A are included with the Medicare, which is like there is two parts within Medicare, and there's a certain limit, there's a certain enrollment time for Medicare. But if you do miss out on those things, you can still apply for Medicare different ways. So I would again check out the links to get more information on those, but I will go through them in a bit. All right. So for Medicare, the enrollment time is usually between January 1st and March 31st. There are special cases to that, so I would look into that if you do miss the time from January 1st to March 31st. And it takes about 30 to 90 days for approval for your application. And if you do not get approved, you can contact Medicare or go through their website and see if there's anything you can do. All right, so as I said, there's two parts with the Medicare. There's Part A, which is the hospital insurance, and then Part B, which I talk about in a bit. For Part A, the hospital insurance costs, there is a premium version, which means Part A that part could be free for some people. But if you do not qualify for premium free Part A, again, you can look into the qualifications on the website. But if you do not qualify, that could cost you about $270 to a little bit above $500 each month for Part A. And keep in mind, you have to sign up for Part B to be able to have Part A. You have to be able to buy Part A. And if you don't buy Part A when you're first eligible, which usually that's about when you turn 65, as soon as you turn 65, you might have to pay a penalty. So I would consider looking to Medicare before you turn 65. So when you do turn 65, you can have your mindset on what you want to do. There's a deductible about $600 for each inpatient hospital benefit period, and that is before original Medicare starts to pay for that. There's inpatient stay and skilled nursing facility stay, home health care, and other health cares that you can also look into those. Some of them could turn into $0 cost for the patient, but some of them could also be 20% off the Medicare approved amount. All right. Next, we go to the Part B, which is the medical insurance cost. Part B doesn't have the premium free version, but it is about 174 and 70 cents each month. The amount can change each year. And that is as of right now in 2024, that is the amount. But obviously each year it does change. And you'll pay the premium each month, even if you don't get any Part B covered services. So keep that in mind. You might have to pay a monthly penalty if you don't apply as soon as you are eligible, which is about when you turn 65, and you will have to pay that penalty as long as you have Part B for it. So the longer you wait, the penalty would obviously go a little bit higher. So I would just look into it as soon as I can, as soon as I think I'm eligible. The deductible is about $240 before original Medicare starts to pay, and you pay this deductible each year, and it's just only once a year. General cost services is usually 20% off the cost for each Medicare covered service. And there are clinical laboratory services, home healthcare services, inpatient hospital care, outpatient mental health care, partial hospitalization mental health care, and outpatient hospital care. And again, not all of them would get to zero, but there is a 20% off the Medicare approved amount. All right. So when applying to Medicare, you will have to go through their website, which I have put the link for them in the slides. You will have to answer a few questions just to see how eligible you are, and if there is more you have to look into. For example, this was one of the first questions when I tried to see if I'm eligible. But for example, I said no, and there are continuous questions that you would have to answer. But if you go with the yes route, obviously the questions could be different. So you would have to describe why you think you're eligible, what's your eligibility, and they will look into that and get back at you. So before I pass it on to Medicaid, I just want to mention that for Medicare, one of the most important things I would consider is to look into it as soon as you can. Even if you're not close to being 65, I would still look into it because Medicare does have penalties if you miss your eligibility time as soon as you become eligible for it. So I would just look into it before I'm 65, and you can see when you can be eligible for it, so you can avoid any additional costs for it. But yeah, thank you so much, and I'll pass it on to Medicaid.
Hello everyone, I'm Vivian Duarte, and I will go ahead and go over how we can apply to Medicaid. Let's begin with who is eligible for Medicaid. It is open to adults who are low income, children, individuals who are pregnant, adults 65 or older, and/or individuals who have a disability. Let's make a note that each state has their own agency and has different regulations, so these options may vary. How do we get started? First, let's check which agency you fall under. You can do this by following www.medicaid.gov. On this online platform, you can find which agency, and then you can go ahead and apply online through them. Let's make a note that you must also be a resident of the state that you are applying to. When applying online, you will go ahead and create an account with the Health Insurance Marketplace. If you are not able to apply online, you can also apply with the worker in person. You can call 800-541-5555 to make an appointment. Documents and information required for application are name and date of birth, social security, monthly expenses, proof of citizenship or immigration status, proof of income, and if employed, any insurance options, and disclosure of any other government benefits. What's next? Once your application is submitted, you will get a response within 30 days. If you are approved, you will be eligible to apply to insurance plans offered in your agency with doctors that are in network. You will have 45 days to select an insurance plan, and if accepted, you will be sent your insurance card via mail. If you fail to choose a plan, your agency will automatically enroll you into a plan that is most common. If you are rejected, you can also work with your caseworker to see what went wrong. Through this assistance, you can reapply at any point during the year. Any follow-ups at this point when you have insurance are to make sure that you report any changes in income, employment, or living situations. And also make sure to complete any annual reports and recertifications to remain in your insurance. That's how you apply to Medicaid. What's next?
ACA is also known as the Affordable Care Act and was a law enforced in 2010 to increase health insurance coverage for the uninsured and to reform the health insurance market to become more accessible. Enrollment for health insurance begins on November 1st, 2024 until January 31st, 2025 for the health insurance marketplace. However, if you apply by earlier deadlines, your coverage begins earlier. So by applying by December 15th, coverage begins on January 1st. As well as applying by January 15th, you can get coverage that begins on February 1st. There's a lot of information to gather for this application process, so make sure you use the checklist in advance to save time. You can access the checklist on healthcare.gov. On the slide, there are just a few bullet points of some of the main information you need to have on hand for the application process. ACA was made to be as accessible as possible, so if you are looking to get healthcare coverage as soon as possible, there are a few exceptions. You can check if you qualify by taking the survey linked on the slide. You may also apply with the same method anytime outside of the application period in the case of a qualifying life event. This means that you've lost your job, you're getting married or divorced, or you're having a baby, or other exceptions. There are 2 easy ways to apply. One of them is over the phone by calling the phone number on the screen, or you can use the official healthcare marketplace at healthcare.gov. By applying online, you'll need to create an account and select the state you're located in. If you select California, it will redirect you to coveredca.com. From here, the application process will align with CHIP. Through ACA, there are also additional benefits. Depending on your expected household income for the year, you may qualify for a lower cost for your marketplace plan, like extra savings on out-of-pocket costs like deductibles, co-payments, and co-insurance. Your children may also qualify for CHIP even if you don't qualify for Medicaid. All marketplace plans cover 10 essential health benefits, including prescription drugs, emergency services, laboratory services, hospitalization, and mental health and substance use disorder services. You can also get free preventive health services and coverage for pre-existing conditions. That's it for ACA. If you're more curious about this, you can visit healthcare.gov for more information.
Hi, I'm Victor and I'm currently a student at UC Berkeley. I will do a quick summary of the presentation. To conclude, applying for healthcare coverage under programs like CHIP, ACA, Medicaid, and Medicare can be straightforward if you know the eligibility criteria and the required steps. Each program serves specific populations, from children and low-income families to seniors and individuals with disabilities, ensuring they have access to essential and necessary healthcare services. For CHIP, eligibility is typically based on income, and states provide coverage for checkups, immunizations, doctor visits, and emergency services. Applications can be completed through state-specific portals like Medicaid in California. The ACA has expanded healthcare coverage for many, with easy online applications via healthcare.gov offering a range of plans for individuals and families. Special enrollment periods can provide flexibility for those who miss deadlines. For Medicaid, eligibility typically varies by state, but it covers a wide range of services including preventive care, mental health care, and hospital care. Medicare, on the other hand, serves seniors and individuals with certain disabilities, providing access to hospital care and medical insurance, with applications managed through Social Security. Just make sure you keep the deadlines and timelines in mind. Ultimately, these programs come together with the aim of bridging the gap in healthcare access and ensuring that all eligible individuals receive the care they need. Understanding the application process and requirements is essential to making the most of these resources. If you have any questions, feel free to contact any of these agencies with the number provided here. Alternatively, more information can be found on www.healthcare.gov. Thank you for your time and attention.